Hello, everyone. This presentation is about Aspect Scoring System, which is a scoring system for assessment of acute ischemia along the MCA distribution and its clinical implications. Aspect is an abbreviation of Alberta Stroke Program Early CT Score, which is basically a program or a system that was developed at the University of Alberta, and this is the publication that was published in AJNR in 2001, based on a non-enhanced CT scan, assessing the early CT findings of acute ischemia, aiming to provide accurate and practical method for acute MCA stroke assessment with clinical correlation. It was based on the ECAS and the NINS studies and trials that pointed out the importance of assessment of early non-enhanced CT scan ischemic findings and utilization of these findings to identify the benefits from intravenous thrombolysis, as well as patients who are unlikely to make recovery despite utilization of thrombolytic therapy, IV TPA. The Aspect score predicted symptomatic intracerebral hemorrhage as well as some functional outcome, which has to correspond to patients' independence in his or her daily activity. It was noted that for intracerebral hemorrhage, Aspect score is 90% sensitive and 61% specific. However, for correlation with clinical and functional outcome, it is only 78% sensitive and has a high specificity reaching up to 96%. Now, how do we use non-enhanced CT scan in assessment for acute ischemia using the Aspect methodology? Basically, we obtain a regular non-enhanced CT scan of the brain, usually obtained at 3 millimeter slice thickness. Then we allocate the slice at the level of the basal ganglia. You've got the head of the caudate, the lentiform nucleus, the thalamus, the anterior limb, genu and posterior limb of the internal capsule, the external capsule, the insula, part of the frontal lobe, temporal lobe, and higher occipital lobe / lower parietal lobe. So we've got the ACA, MCA, and PCA distribution. 2 centimeters above this level is actually the level of the bodies of the lateral ventricles, and you've got mainly frontal and parietal lobes with good gray-white matter differentiation. Then 10 points, all within the distribution of the middle cerebral artery, are identified. Some are related to cortices, and others are related to basal ganglia and deep white matter. You've got the head of the caudate, the lentiform nucleus, and the internal capsule. These are 3 points. You've got the insula, 4th point, and you've got 6 cortical points, M1, M2, and M3. Corresponding to it is M4, M5, and M6, representing the lower and the higher cuts for anterior, lateral, and posterior cortices, all within the distribution of middle cerebral artery. Now, during the Aspect study, some of the investigators evaluated both the anterior limb, genu, and posterior limb of the internal capsule, while others only limited their evaluation to the posterior limb of the internal capsule. If the patient has all these points preserved, then the Aspect score is 10 out of 10, which is the absolute normal. For each location that loses its normality, meaning there is evidence of acute ischemia, may that be edema or gray-white matter loss of differentiation or mass effects, etc., then we lose a point for each location. If we lose more than 3 points, then we reach a score of 7, which is a critical score in patient's outcome. Now, if we lose all 10 points, that's a score of 0, which is usually the massive MCA infarction. Now, I'm going to show you 3 examples. The first example is this patient that has acute ischemia within the distribution of the right MCA. You've got low attenuation changes with the loss of gray-white matter differentiation, a bit of swelling, and effacement of the cortical sulci in the anterior cortex, which is M1 location, the insula, as well as the internal capsule. The higher cut is preserved, so that's 3 points lost, so the aspect score is 7. The second patient here has lost a bit of parenchyma at the lower cut and other areas at the higher cut. You've got the anterior cortex at M1 and M4. You've got the lateral cortex at M2 and M5, and you've got the internal you've got the insula. So that's 5 out of 10. So the score is 5 out of 10. The last case I'm going to show here is this patient with actually even more extensive infarction involving 7 different locations within MCA distribution. You've got the M1, which is the anterior, the M2, which is the M2 and M5, which is the lateral cortices. You've got the insula, as well as the lentiform nucleus, the head of the caudate, and the internal capsule. So this patient lost 7 points. So that's actually a score of 3. Now, why score of 7 is critical? Because once the patient has an aspect score less than 7, then there is an increased incidence of intracerebral hemorrhage, increased incidence of patients not being dependent functionally with poor outcome and maybe mortality. For those patients, we don't usually recommend IV thrombolytic therapy, IV TPA. However, this should be taken in consideration of the general patient's condition and clinical context. I hope with this quick presentation, I explained the aspect score system, which is used frequently by our colleagues in neurology for assessment of acute ischemia within the distribution of MCA and correlating that with the patient's outcome, the patient's possible complication and morbidity, as well as the patient's benefiting from intravenous thrombolytic therapy. Thank you very much.